So I was at an event last night. I was a panelist on midlife health, and a really good question was asked. And it was, what do you do with a woman who doesn't want to take hormone replacement therapy? What can she do to maximize her health in menopause? So I want to address that today. And here are my thoughts. One is, I want to know, if it's not too intrusive, what are the factors that went into the decision not to take hormones? Because I just want to make sure that it's an informed decision. I want to make sure that that decision not to take hormone replacement therapy isn't just a knee-jerk reaction of fear based on 20 plus years of misinformation about hormone replacement therapy. I've known for a long time, and now people are starting to understand that menopause is a hormone deficient state. And if you are living in a hormone deficient state, the best treatment is to replace the deficient hormones. But it's not for everyone. And so we want to individualize our care and make the right decision for you. So that's what I would want to know is what are your concerns about hormone replacement therapy? And if it's based on outdated data, then let's talk about it and maybe you make a different decision with new information. That's number one. Number two, what are your goals for your health? What are your goals for your life? What's important to you? That's super important to know. And you can't figure that out in a 10-minute appointment. Good grief. And here's where, the important things come in is the hormone locksmith of making sure that your cells are healthy and that you have a fighting chance to make energy and keep your brain functioning, because hormones are important for the right person, done right and evaluated correctly. But the other half of the equation is making sure that you have nice, healthy cells with functioning mitochondria and hormone receptors and cells that can do the job. So that gets into get enough sleep, drink enough water, don't eat crap. Make sure you have the appropriate macronutrients like protein and healthy fats in your diet. Make sure that you're getting enough micronutrients, which means you got to check your levels to know, because you can't just guess. And the RDA for these vitamins is far from adequate to achieve optimal health. Let's look at inflammatory markers. Let's make sure we keep your inflammation low. I think properly done hormone replacement therapy is a bonus to lower inflammation, but there's lots of things that you can do to lower inflammation. Let's make sure that you're not having ongoing toxic exposures that damage your body and cause inflammation and damage your mitochondria. So we can certainly look at all the other things that go along with healthy function and make sure that you have the foundations ready. Make sure that your nervous system is not living 24/7 in the fight or flight mode. And that's a big problem in our country. All the things that we do to make sure that your hormones work right in my practice when we have you on hormone therapy are going to benefit you significantly, even if you don't take hormone replacement therapy. When I think about it, I'm guessing in our practice, I guess it's about maybe 70% of our patients in menopause, maybe not quite that many, are on hormones, but not everyone. And so we certainly work with the ones that are not in order to help them maximize their health. There's so many things we can do, but it has to start with that conversation and an informed decision made with your desires, your priorities, and all of that to make the decision, and not just, well, I heard hormones are bad, so I don't want to take them. One thing that I wouldn't recommend is, let's use a bunch of other medications to try to stop your hot flashes. Unfortunately, that's what my college recommends, the College of OBGYNs. There's a committee opinion out there that was written before the black box warning was lifted, but the recommendation was, non-hormonal strategies for managing menopause, and one of them was layer your clothing. So that when you're having a hot flash, you can just rip off a layer. I'm sorry, that makes me laugh. Can you imagine sitting in your meeting with an important client or a boardroom or something like that, and all of a sudden you're like, oh, excuse me, folks, I'm having a hot flash. I'm going to start taking some layers off. But it cracks me up. That's not a solution. And the other thing is, other than these natural remedies, which are super important whether or not you're on hormones, you're going to be looking at polypharmacy. You're going to be looking at a lot of different medicines to try and fix a hormone deficient state. So some of the other things that people try are anti-anxiety medicines because mood swings and anxiety can happen with these hot flashes, and blood pressure medicines. I don't want to prescribe a bunch of other synthetic medicines to try to ease hot flashes without a really good reason, because these other medicines are synthetic and they have side effects, and there are more things for your liver to try and process and clear that God did not necessarily intend you to be exposed to. So I truly believe that if your problem is hormone deficiency, that the best solution is hormone replacement. And we'll work with you no matter what you want to do, no matter what your priorities are. And yes, I will say that hormones are not for everyone, but let's have the individual conversation with a knowledgeable provider before you make that decision. I'm Dr. Yvonne Karney. I'm the Hormone Locksmith. If this is helpful for you, please follow and like. And if someone you know needs to hear this, please send it to them. And if you're wondering if you have hormonal issues, take my hormone quiz. It's a very detailed hormone quiz, and it will help you identify which hormone imbalances you likely have, and then provide you with some strategies to try to get them rebalanced. We'll see you next time.